Hi everyone, just Dr. Ted again, and thank you for tuning into this one. And it's still March the 14th, Tuesday, and once again, welcome back. This one is in answer to a dear friend, Dan from Richfield. He is a dear friend of me and my wife Sue, and he asked a very good question. This one, he starts out, well, first of all, he talks about mono, and he says, I wish I would have known the info about mono a few months ago when my youngest boy thought he had strep throat and ended up with mono. Man, that was a long couple of weeks in the middle of finals. Isn't that when it always happens too, right? When you can't have it happen. And then he asked this great question. Would love to learn more about gout or gouty arthritis. What you got? I loved it because I have seen this. I learned this in residency. I am not exaggerating. I've seen this at least 400 or 500 times because nobody with gout, when it flares, doesn't come in. It is so painful. They all come in. And it's like 9-1 men over women. For every one woman that gets it, 9 men get it. I don't know why that is. It's just maybe a rheumatologist knows. I worked with a rheumatologist, Dr. Harold Vonk, V-O-N-K. He was brilliant. He'd go around the country lecturing on rheumatology. And he taught me about gout, and I'm so glad he did because I saw it all the time. I saw it at least once or twice a month. When you work in urgent care, you see it frequently. I've done this for 30 years. I've seen hundreds and hundreds of gout. So that is a fantastic question, Dan. Thank you for asking, and this one will be fun to teach. And if you know somebody that has gout, you got to have them watch this because hardly anybody knows how to treat it. I am not kidding. I learned this from the best rheumatologist. So first of all, here's what gout looks like. Look at that toe. That's the most common place you'll get gout, in that first joint of your toe. Where's my little pointer? In the first joint of the toe, that's where you most commonly see gout. And look how red and swollen that is. And let me tell you, you try and move that person's toe. It looks like a female. Here I just tell you men get it, but I hope that's a woman. Maybe nowadays, who knows, right? That could be a dude. Anyway, red, hot, you barely move that person's toe, they will be in tears. They will hit the ceiling. It is excruciating. I mean, it's like 10 out of 10. I've had women say, I'd rather have a baby without an epidural than gout. And look at this. Here's one. The whole foot can be swollen. Sometimes just the joint. But look at that. The whole foot. So it's not just that joint. It's all these joints. And I promise you, this person came crawling in. They can barely walk if they can walk at all. Seriously, I've had people come in on wheelchairs, crawling in. They're in tears. These are grown men. It's more common as you get older in men. So I saw a lot I've seen it in 20s and 30-year-olds, but I saw it a lot in 40s, 50s, 60s, 70s. Look what else it can do. It can get in your knee. There's a gout knee. And sometimes the doctor will think that's a bacterial infection in the knee, and it's not. They'll put you on antibiotics and it won't work. Nothing happens. And it's gout. And the only way to know is to get fluid out of that knee and look under a microscope, and you can diagnose gout. One other picture, look at this one, ankle. I've seen this a few times. I've seen it in the knee only like once or twice. In the ankle, I've seen it a dozen times, but almost always it's in the foot. And look at that red, hot, swollen ankle. And look at that one. That's a picture kind of makeup, but that one's real. Look how swollen. They can't even bend that ankle. So they all come in. It's excruciating. I am not kidding you. So what causes gout? Okay. If you go look if you Google it, this is what you'll find. Here's gout. Here's what it is. Diet and all these nucleic acids, purine. It goes down here. It's really hard. And if that's not scary, look at this one. No wonder nobody understands it. Even doctors sometimes don't understand this. But I had it very easily explained to me by the best rheumatologist, I swear, in the United States. And I think he's retired now, but man, he was brilliant. Here's how I learned it. Tell me if you like my way better, okay? This is gout in a nutshell, and this is all you need to know. This is any cell in your body. It could be a brain cell, a skin cell, a heart cell, muscle cell, bone cell. We're made up of trillions of these little cells, right? And in each cell, you have your DNA, your genetic material called your DNA, deoxyribonucleic acid, or deoxynucleic acid. And it goes to, and when you, every day you have to eat food, right? Every time we go, go out to lunch or dinner, we eat food. And that's because old cells die and they get broken down. And when they get broken down, our body breaks them into chemicals and then puts them into liquid. And they go through your kidney and you urinate those old cells out, or they go through your bile and your liver into your bowel movements. And when you have a bowel movement, that's when you go to the bathroom, number 1 or number 2, you are getting rid of the old you. Part of that is undigested food, of course, and a lot of it's bacteria and stuff like that, but it's all the breakdown products of your body. In fact, what gives urine its yellow color and stool its brown color is the breakdown of blood. Right? When you break blood down, it changes from red to yellow, just like it's the iron pigment. Like in leaves where they're green all year, and then in the fall they turn from green to yellow or red or orange because the pigment changes. Well, that's what happens to blood. It goes from red color to yellow color or brown, and you get rid of it. That's how you do it. So every day you're breaking down old cells and new cells are being born. That's why you have to eat. You have to create new cells. The old ones die, new ones take their place. Just kind of like the human population, right? The old ones die and the young ones take their place. And that's kind of a dumb analogy, but so the DNA products break down through a series of chemical reactions into a chemical called uric acid. That's the bad guy in gout. These things break down. There's a series of chemical reactions your body does and creates uric acid. For some reason, some people do just fine. They never make too much uric acid. But some people, genetics, maybe a medicine they're on, family history, certain diet foods they're eating, but it's usually not too much diet. It's usually genetics. It's almost always genetics. I've seen a few people on some blood pressure medicine, like thiazide medication, will make you get a gout flare. If you have any propensity to it, you will get a gout flare if you are on thiazide. That doesn't mean you can't take it, but if you have gout, you want to stop thiazide. And maybe nobody told you that. And here you are, you have gout and it flares all the time and you're on a medicine that causes it to flare. So thiazides and gout, do not do those two. Some people though, for some reason, their uric acid skyrockets. When uric acid gets into your joints, it causes inflammation, or that red, hot, warm, painful joint, red, warm, pain in the joint. And I should have put exclamation point because you saw those pictures. They're red, they're hot, they hurt. Any movement of all, not in a finger, but in their toe, any movement, and they'll just tears and they'll hit the ceiling. They are in agony and they're just begging you, please, can you stop it? So here's what you do. Here's the secret about gout. There's 2 parts to it. First of all, when you're inflamed, you have got to you've got to put the fire out first, right? Before you do anything, you got to put the fire out. So here is that part from the uric acid. This is kind of a busy picture here. I just drew this. Uric acid, inflammation. We've got to stop the uric acid and inflammation. We've got to stop that. How do you stop it? Anti-inflammatories. So an anti-inflammatory is something that turns your immune system, the white blood cells, says, hey guys, cool down, not so much. It's kind of like your immune system is trying to clear up all that uric acid in your joint, but it goes way above and beyond the call. It overshoots and you get that red, hot, swollen joint. So first thing we got to do is get that reaction to cool down. How do you cool it down? Anti-inflammatories. Ibuprofen, Advil, Motrin, generic. I don't think the generics work as good as the name brand. I don't own stock. I just tell you from experience. Try the name brand Advil. Try the name brand Motrin. 3 or 4 pills, 2 or 3 times a day. No more than 3 times a day. And really, 3 pills should be enough. 3 pills 3 times a day. That should turn this off. It's relatively okay. It's not the strongest one. They also have... So ibuprofen is one. They also have another one called indomethacin or Indocin. The problem is older men tend to get gout, and older men, indomethacin can be really tough on your stomach. It can cause gastritis or inflammation of your stomach lining. It can cause ulcers. So we kind of shy away from indomethacin, but it works. And there's a lot of doctors that use it. The rheumatologist I worked with, he said, I will never give indomethacin to anybody older than 50 because of the stomach. And there's some kidney things as well. This is the magic bullet right here, colchicine. Colchicine is a miracle drug for gout. And what you do is they're the 0.6 milligram tablets, And if you want the cheaper version, get the 0.5 milligram tablets. You don't take notes and listen to this again. And you take 2 pills to start with. Then you take 1 every 6 hours until the joint starts to feel better. And it's quick. It's pretty quick. And if you really want to increase it, add some prednisone with the colchicine. And I've even seen doctors give an injection of, but nobody wants you to stick a needle in that hot red joint. So give them prednisone by mouth, and you can cool that inflammation down immediately. I mean, they'll call you in hours and say, that is great. I feel so much better. Thank you. They love it. Colchicine, 2 pills to start with, then 1 every 6 hours. Usually in 24 hours is all you need to do. Then you do 1 with breakfast, 1 with dinner for 3 or 4 months, every day for 3 or 4 months. And you got to get that inflammation turned off, and it's got to stay down and cool down and be down for months before you start the other medication. If you start the other medication too early, it'll flare again. And that's the mistake a lot of people do, doctors and providers, is they'll say, oh, here, take some ibuprofen, or here's some prednisone, or even colchicine. Maybe they even know that one. And then it'll cool down, and then they'll put you on this new medicine I'm going to tell you about, this next one, and it flares again. And nobody told them that that second medicine can make it flare. Okay, so in a nutshell, DNA breaks down to uric acid. Uric acid causes inflammation, which makes your joint red and swollen. First thing, turn the inflammation off for 2 or 3 or 4 months before you do anything else, right? Then, after the inflammation's gone down, and you'll forget how much it hurt 2 or 3 or 4 months ago, then we've got to stop the reaction to break your DNA down to uric acid. There's a series of chemical reactions, and there's a chemical that will stop the overproduction of uric acid, which causes the problem in the first place. It's known as allopurinol. The trade name is Xyloprim. Anybody with gout will tell you, allopurinol and Xyloprim. A lot of doctors will start you on this as soon as the joint is cooled down in 2 or 3 days. And allopurinol, the scary thing with allopurinol is it can make it flare if it's not totally cooled down, or if it's not cooled down long enough. You've got to get that red joint redness and pain gone for 3, 4 months, at least 2 months, and then you start allopurinol and keep the colchicine going for 1 more month. So for the first 2 or 3 months, you're taking just colchicine, morning and evening. Then after the first day, you take a cup, 2, then every 6 hours. Then you take 1 with breakfast, 1 with supper for 2 or 3 months. Then you add allopurinol with the colchicine. Allopurinol's once a day, and you got to start with 300. Don't go too low. Some people start 100. It's not enough. It's like using a bucket of water to put out a house fire. You need the fire department and a hose. Probably several hoses, right? A bucket is not enough. So 300 milligrams once a day with the colchicine for 1 month. You're taking both. Then stop the colchicine, and as long as you take allopurinol every day for the rest of your life, you'll never get gout again. I am not kidding you. It will never come back. But you know what happens? This will be shocking to a lot of you. Men, after a year or 2 or 10, they think, I haven't had gout in 10 years. I don't think I even need this allopurinol anymore. And they'll stop taking it, or they just don't get it refilled, or they forget. And then they think, I haven't taken my allopurinol for a few weeks, or maybe a few months, maybe even a year. But sooner or later, that DNA will break down and their uric acid will spike from something. The cold temperature on your joints, that's why it seems to be in the foot. Maybe colder temperatures makes that uric acid form crystals in the joint, and those crystals make it inflamed. Sooner or later, it'll flare again. The first question when I see a guy come in with gout and that their joint's red and hot and swollen, I'll say, have you ever had this before? Yes, I've had it before. Were you on allopurinol? Yes. Did you stop taking it? Yes. And it's always the same. They always forget, or they just stop it. They may have taken it for 10 years, but sure enough, it'll come back if you stop it. You've got to then you got to start the whole thing all over again. You got to treat them with got to get rid of the uric acid inflammation with the colchicine again. Whoops. Well, that's the guy with gout. You got to stop. Whoops. I'll ask my pointer. You got to stop the inflammation. Again, got to go back to 2 or 3 months of the colchicine. Then you can start the allopurinol and take them both for a month, and then never stop it. And this is what I'm going to show you. That is what guys with gout look like. And see, I showed you a guy because it's usually guys. middle-aged and older guys, and that's what they look like. If you use colchicine twice a day for 3 or 4 months, and then allopurinol plus colchicine for 1 month, and then stop the colchicine and stay on allopurinol forever, this is what you'll see. That I've seen this. It's so fun because they'll say nobody knew how to get rid of it. Well, a rheumatologist would, but who can get into a rheumatologist nowadays? They're expensive. It's hard to get in. They're way overbooked. And I hope maybe even some doctors learn this because this works 100% of the time. It never fails. Colchicine for 2 or 3, 4 months, twice a day, then allopurinol with colchicine for 1 month, then stop the colchicine forever and allopurinol every day till you die. And that will be you. You can look just like that, even with gout. You can live with it and never get it again. So hopefully, Dan, that answered your question, and teach that to somebody that you know, and hopefully that helped. If anybody has any questions, just put them in the comments. When you watch the video, there's a place to put comments, and I'll get them and we'll answer them just like this. I love the questions. These teach me what I can talk to you about. And if I don't know, I'll find somebody who does know, and we can answer these questions. You can also get me at Ask Dr. D-O-C-T-O-R Ted, askdrted@gmail.com, and I'll answer any questions you have. It might save you some money and some time. Okay, and some pain. Okay, thanks, you guys. Have a good one. See you, Dan. Bye-bye.